Okay, so this one is the 3 checks and rights of medication administration. So with 3 checks, these are 3 things that the nurse has to do with every single medication before he or she gives it, followed by this 11, 12, I don't know, every time I look there's more. Rights of medication administration, okay, and that has to do with both the nurse and the patient. So why do you think that we have to have at least 3 checks with every medication before we give it?
To prevent error.
Oh yeah, to prevent errors. Okay, so let's look at this and then I'll entertain any questions. Can we see it? Yeah, we can see it.
Good morning, Marisol.
Hi, Ms. Hill. I'm going to be administering medication to some of my patients today, so I was wondering if we could go over the 3 checks and rights of medication administration.
Good idea. Let's begin with the 3 checks. What can you tell me about them?
Well, the 3 checks are a way that we ensure medication is being administered safely. The 3 checks means that we have to check the unit package container 3 times before administering it to the patient.
That's right. Tell me, why is this important?
It's important to make sure the right medication is going to the right patient.
Exactly, the right medication to the right patient. So talk me through the 3 checks.
Okay, I'll show you. So I start off by logging into my system. This is my patient list. I know my patient's name begins with an S, so I'll select my patient. I've already given 3 of these medications, so the only one that needs to be administered right now is furosemide, 40 milligrams. So the first check occurs after reading the EMR. I'll read the label. When I select the unit dose container, I'll select the medication, and it should be in drawer 1, bin C1, which is right here. Furosemide 40 milligrams, furosemide 40 milligrams. The second check occurs when I compare the package to the EMR. Furosemide 40 milligrams, furosemide 40 milligrams. And then the third check occurs at the patient's bedside when I ensure that this is the correct medication for the right patient.
Yes, your thinking is correct.
So basically, read it when I reach for it, when I compare it to the EMR, and before I give it to the patient.
Essentially, yes. You read it those 3 times before administering the medication.
Okay, can you
What
stop
about when the
for a
medication is
second?
delivered in a multi-dose?
So, when is your first check?
When you reach for it.
When you're reaching for it, okay? When is your second check?
Compared to the EMR.
When you compare it with the medical record, right? And then when is your final check?
At the patient.
In the patient's room at the bedside, okay? The only caveat to the third point is that if you're in your extended facility, they have those big multi-dose vials that I was talking about, like multivitamins, lactulose, whatever. You're not gonna take that huge bottle into the patient's room. So you will do your third check, right after you pour it before you bring it to your patient, okay? But that is super important, so no matter where you go and what type of dispensing system they have for medications, you will do those 3 checks. If you do those 3 checks for every single medication, for every single patient, you'll never make a matter of it. Okay, because you're giving yourself 3 opportunities to catch yourself, okay? All right, good.
Container.
Well, then the label is checked for the second time immediately before pouring from the multi-dose container.
And what about the third check?
There are several ways to do the third check. It is important to know your hospital policy. The third check can be completed by comparing the label with the EMR a 3rd time before you put the container back. If you do this, be sure to label the medicine cup you are using to administer the medication to the patient.
What should be on the label of the container?
The patient's name, date of birth, ID number, the medication, and the dose.
Okay, got it. What's the other option for the third check?
Take the container with you to the patient's room and complete your third check at the bedside when you recheck the label with the MAR.
Makes sense.
Can you think of any situations when you would not want to bring the multi-dose container into the patient's room?
Let's see. If the patient is on isolation precautions?
Yes. Now let's move on to the rights of medication administration. Marisol, what are those rights designed to do?
They're designed to outline the goals or desired outcomes of safe medication administration.
Correct. Keep in mind, the rights themselves do not ensure medication safety. The nurse assumes individual accountability for safe drug administration by collaborating with the interprofessional team and engaging in behavior that follows standards of practice and behaviors prescribed by the institution to achieve the goals of the rights. When followed correctly, these rights help every nurse verify that the right medication is given to the right patient in the right dosage in the right form, through the right route at the right time for the right reason, based on the right or appropriate assessment data using the right documentation and monitoring for the right response by the patient. Some lists of the rights of medication administration also include the right to education and the right to refuse. Why are these rights so crucial?
Because one little mistake can have big consequences. A person can get too much medication or miss a dose.
Very good. You want to make sure that you're giving the medication for the correct reason based on the drug information and based on the patient's needs and assessment. So I see your patient has furosemide due. Walk me through how you would apply the rights to this specific medication.
Okay, so I'll make sure I retrieve the right medication, furosemide, using the 3 checks for Mr. Strickland, the right patient, who I'll verify using the 2-step process. Making sure I retrieve a 40 milligram tablet, the right dose and right form, and administer it to him PO by mouth, which is the right route. At 0800, the right time, for the right reason, his history of heart failure, based on the right assessment data, which includes edema, occasional shortness of breath, and his documented history of heart failure. Then I will document the administration, which covers the right documentation, and monitor Mr. Strickland for the right result, an increase in his urine output and a decrease in excess fluid volume.
Marisol, what are your thoughts on the right education and the right to refuse?
Well, it makes sense that the patient would have the right to refuse a medication if he or she doesn't want it.
It makes a lot of sense. Patients have a right to make autonomous decisions about the care they receive and can refuse a medication if they choose. Now, Marisol, what's the reason for ensuring the right education?
Because nurses need to know about the medication before they give it. In this case, I need to know that furosemide is a loop diuretic that works by blocking the absorption of sodium, chloride, and water, which results in an increase in urine output. I also need to know that I need to monitor my patient's potassium because loop diuretics are not potassium sparing.
That's right. But who else might need some education about the drug?
Well, the patient.
Correct. The patients need information so they can make an informed decision. That information also helps them to understand their medications so that they can manage them safely and effectively once they return to their home.
That's a good point. Perhaps one thing I can stress with Mr. Strickland is that this medication works in about an hour and may last 6 to 8 hours. That's why we recommend taking it in the morning, not at night.
Good job, Marisol, and a good review of the 3 checks and the drug administration rights.
Thank you.
Okay, let's head into Mr. Strickland's room.
Okay, so you see, even though the rights of those medications have gotten quite lengthy over time, you see how the nurse model used it to cement the concept of the rights. Does that make sense? Right, so it's almost like it's a teaching tool, so you're learning about the medication, you're applying it to the rights. And the rights are in place because protection for
Lawsuit.
us and the patient, right? because as long as we're following that, keeping it in mind, we're gonna be like, oh, wait, I got the wrong patient, I'm not doing this, or it's the wrong time, or it's the wrong medication, whatever the case may be. Okay, so that's why we have it in place. Good. Does anybody have any questions about that? We're good?
Yeah.
Okay. Yeah, let's move to the next one. Oral medications? Okay. Is the screen good?
Yeah.
Yeah?
It's taking longer than usual. It's coming up.
Oh. Oh, yeah.
Alright, let's
Oh, I have to let them know. It's
normally it's quicker.
much quicker.
Okay. Alright, that's good.
Better.
All right, so we've got your medications ready and we've checked the labels twice already. Now, before we go to administer these to your patient, what else can you tell me about oral medications, their properties, how they work?
Meds have a slower onset when taken orally. This route has a more prolonged but less potent effect than other routes.
Right. And what else should you keep in mind about digoxin, one of the medications we're about to give?
I need to keep in mind the actions, special nursing considerations, and safe dose ranges of the medications to be administered.
Right, because bottom line, as the nurse, you are in charge of that patient's care, and you need to consider the appropriateness of the medication. And of course, always make use of the 3 checks and the rights of medication administration. And remember, you also need to know the purpose of administration and any potential adverse effects, right?
Yes, and check for any allergies the patient may have.
So are you ready?
I am.
Good, let's go see your patient.
Good morning, Mrs. Lemon. I'm Christy, a student nurse who'll be working with you today. How are you this morning?
Doing well, thank you.
Good, I'm glad to hear that. Well, this is Mr. Allen. He's my instructor, and I'm here to give you your medications that are scheduled for 9 a.m.
Alrighty.
Now, Christy, go ahead and sign in on the computer and confirm your ID.
Okay. Now, I'll need to check your ID band. Can I have a look? Thanks. And what's your name?
Eileen Lemon,
And your birthday?
February 3rd, 1951.
Thank you, Mrs. Lemon. Now, I'm going to check that your ID matches the computer. It does. And now I'm going to scan your barcode on your ID. And we're all set. Now, according to your chart, you don't have any known allergies. Is that correct?
As far as I know.
Okay, I'm going to check your heart rate before I give you your medication.
That's because of the digoxin, right? That's for my heart. I checked my pulse at home when I first started the medication.
I see. Yes, I'm checking your heart rate because of the digoxin. Is it okay if I put my stethoscope under your gown to take a listen?
That's fine.
Everything sounds good. 72.
Okay, Christy. Now, it's important to explain to Mrs. Lemon about the purpose of each medication and the action of each medication before you administer them.
Right, I'll do that as I go along.
And you'll want to remember to check the medication label for the 3rd time against the MAR, and then scan the barcode on the medication.
Okay, right. The 3rd check for the digoxin is done.
Good.
All right then, Mrs. Lemon, we're ready to start with your first medication, and this is digoxin. Your heart rate is within normal range, so we can give you the medication. Would you like it in a little cup or in your hand?
In a cup, please.
Okay, and would you like water with this?
Oh yes, I'm not the best pill taker.
Me neither. So here's the digoxin and some water. Yeah, thanks.
That's good, Christy. Always offer the patient the option of water, if they're allowed to take it, and the ability to take the pill in their hand or in a small cup.
Okay.
And then it's important to remain with the patient and watch them take the medication. Never leave the medication at a patient's bedside.
Got it. Okay, Mrs. Lemon?
Yes, the water helps.
And always wait to document the medication in the MAR until you've actually seen the patient take it.
Okay. One more to go. Your guaifenesin. I'll just check this against the MAR. And this is check 3. And I'll scan the barcode. The dosage in the cup is correct. Now this drug is also to help decrease your cough. Did it help yesterday?
Yes, I think it did help.
And here you go.
Okay.
And that's all, Mrs. Lemon.
Thank you. I'm glad you brought my medications on time. At home, I use a checklist to remember to take them. I have checklists for everything. Don't know where I'd be without them.
I use a lot of checklists too, to keep track of schoolwork. Here, let me take that for you.
Okay, Christy, let's document the heart rate you obtained and confirm the administration of the medications in the computer.
Okay.
And then once all of the medications have been administered, you'll want to evaluate the patient's response to the medications within the appropriate time frame for each drug.
Okay, I think that about does it.
Is there anything else we can do for you before we leave, Mrs. Lemon?
No, I'm fine, thank you.
You're welcome.
Okay, I'll be back soon to check on you. Just use the call bell if you need anything before then, okay?
I will. Bye.
Take care.
Any questions on that? Fairly self-explanatory, right? Yeah. Okay. And then we have, I think, unit dose or it was, definitely. Okay, this is the last one.
Hey, Erin. So before you administer the medication scheduled for 9 a.m. for your patient, I want to go over how to prepare unit dose medications for administration.
Okay, that'll be great. My first patient has a few prescribed medications.
Now, you should know the actions, special nursing considerations, and safe dose ranges of the medications to be administered.
And also the purpose of any administration and any adverse effects, right? And make sure my patient doesn't have any allergies.
Right. As the nurse, you are responsible for your patient's care and need to consider the appropriateness of their medication, looking it up in the administration guide if necessary. And always make use of the 3 checks and the rights of medication administration. So, what's first?
Easy. I perform hand hygiene.
Of course, and then you gain access to the medication storage unit.
Okay. I unlock the medication drawer. And then I enter the passcode into the computer and choose the correct patient.
And remember, we only prepare medications for one patient at a time, okay? So what's next?
I read the medication administration record, the MAR, and select the proper medication. According to the MAR, my patient gets 1 multivitamin tablet PO daily. Administering a multivitamin, a dietary supplement, is appropriate given the fact that the patient is having some difficulty maintaining sufficient food intake. So I take the proper package out of the medication drawer, multivitamin.
Right, that's check 1. Check 2 is to compare the package label to the MAR again. Check the expiration date.
Looks good. And I place the unit dose package medication in a disposable container. Doesn't matter if I open the unit wrapper now or when I'm ready to give it to the patient.
Only open the unit package when you are with the patient and ready to administer the medication.
Okay, so I don't open the wrapper until I'm at the bedside. Next is 0.125 milligrams of digoxin PO daily. Let me get that out of the drawer.
and do check 1. Okay. Administering digoxin also makes sense, as she has a history of heart failure. So I do check 2 again. Compare the medication label to the medication administration record, and that's right. And I should put it in a cup.
Good. Placing the digoxin in a separate cup is the right thing to do. In fact, you should always keep narcotics and medications that require special nursing assessments in a separate container. Do you know why?
In this case, yes. Before this medication can be administered, I have to take the patient's apical pulse rate for 1 minute. And the order says if the apical rate is less than 60, I should withhold the order and not give the digoxin.
And if it's less than 60, you should also notify the primary care provider.
Right. So, the last medication she needs is 20 milligrams of furosemide. Furosemide is also used to treat heart failure, and her serum potassium level was within normal levels from this morning's labs. But I should check her blood pressure again when we get to her room, as it's not been done since the 7 a.m. shift change. So I'll get it out and do check 1. Okay, and then I'll do check 2. Alright, the furosemide can be placed in the same cup as the digoxin because I need to hold this medication if her blood pressure is lower than the parameters set by the order.
That's correct.
And that's it. These are all the medications she needs at this time.
You know, some facility policies require you to perform the third check of the medication labels with the MAR now before taking them to the patient. However, here we'll do the third check at the bedside after confirming the patient's identification. Then we'll scan the barcode on each of the medications at the bedside. Now, before we go, exit out of the medication supply unit.
Right. And we'll bring the computer and the medications. I already got our fresh water.
Good thinking. Keep in mind, you should transport medications to the patient's bedside carefully and keep the medications in sight at all times. Okay, let's go see your patient.
Any questions on preparing the unit dose medication? What have you seen in your sites? Anything similar, different?
So that they put all the medication in the same cup. That's what I saw.
Same cup.
In the same, yeah. They dump everything in the same thing, cup and just.
Do they open them before?
Yeah,
they
it would
put
open. Yeah, she
It's
opened
like
at
a
the nurse station where they have all the medication.
Uh-huh.
And she just put everything in the same cup. It was like about 8 medications. And just went to the room and gave it to
So
the
how does the patient take all those medications?
She gave him, one by
She
one.
gives
But
them one by one?
yeah, but it was quick.
Okay.
And another nurse, another time I saw that she just told the patient to take it and left the room.
And she left the meds there, that's
Yeah.
it?
And I've seen
Yeah.
it where they just give the maybe 8 in there, 5,
'Cause he was giving
and
us
they
some
just take it
attitude.
one time.
The patient was giving us some attitude. He's a resident there, so.
Uh-huh.
So he was giving an attitude and she told him, okay, he took 1 or 2 and then she said, okay, you gotta finish them, okay? And she just left.
No, see, you can't do that. You have to either stay with the patient.
I'm like,
while
what we
they
learned
take
here,
it,
it's totally
right?
different than
Or
what
you
we
take
see.
it back with you, so it's better to open it at the bedside, because this
Yeah.
way, if they're not going to take it, then you don't have to open it.
Right.
Some keep the med card in the nurse's station, just walk back and forth and put in the orders.
Is that the policy of the place,
But
or
then I
is
saw
it
just a picture
individual?
of taking the med card, so
Nobody takes the med card?
I saw that like on the other side.
Okay.
They took the med card.
They
Again,
took the
that's-
med card.
I guess
Okay.
it's fashion.
Yeah, but it shouldn't be
They took the whole-
preference, right? You should always follow the policy of the institution, right? Because if you have everything there and you can sign for it when the patient gives it, why would you? That's why wherever you go, just be mindful of what the policy is. If you start to see things that maybe differ from nurse to nurse, then you gotta inquire. Ask your instructor, and your instructor will inquire as to what's the procedure, because you need to follow the procedure, yeah. Okay. All right, so PO, practicing of PO medications, we will, the actual opening one, it's pretty easy, but we'll do it when we do NG, so you can see how we brush and open. Okay, so that's a good segue. All right, now we're gonna do IV, PO, not PO, parental medications, sub-Q and IM. Okay, so now, do you remember who went in first? The last one. Which side?